Hello and welcome to our video, Battling Diseases, Vaccinations, created by myself, Claire Chumbley. The goal of this project is to inform you and others about both opinions of receiving vaccines, to inform about the positive benefits of vaccinations, and to hopefully then persuade others that using them will create positive effects for your health. Here are just some of the pros of using vaccinations. Vaccines decrease or prevent the chances of obtaining diseases that may harm you. They also decrease or prevent the chance of you passing diseases on to others who are not or maybe cannot be vaccinated. They prevent major outbreaks from occurring and causing high damage throughout the world. They will prevent further damage and potential damage from occurring. Vaccines eliminate or greatly decrease the possibility of obtaining an accidental illness or vaccine-preventable illnesses. They prevent death and other life-changing symptoms from occurring, and it is always better to be safe than to be sorry. We are now moving on to the research behind the pros of vaccines and how they can benefit you. A major benefit that vaccines have been proven to do is save millions of lives and reduce mortality and infection rates. According to Shot at Life, vaccines save 2.5 million children's lives around the world every year, roughly equaling 285 children's lives saved every hour. The Centers for Disease Control, or the CDC, estimated that between 1994 and 2014, 732,000 American children's lives were saved by vaccines. They also estimated that 322 million illnesses were prevented by vaccines in those 20 years. Also, the measles vaccine has decreased child mortality rates by 74%. Most vaccines have evidence behind them showing that they prevent death. So receiving these vaccines will help dramatically decrease your chances of something awful like that ever happening to you or to others around you. Since vaccinations for many diseases like smallpox and rubella have been created, the diseases have had very low impact on human health and in some cases almost no impact at all. The smallpox vaccination eradicated the disease, meaning now smallpox isn't a threat at all and we no longer have to receive the vaccination for it here in the United States. With the rubella vaccination, it has greatly decreased the chances of pregnant women passing the virus on to their unborn fetus or newborn children, and that has decreased the chances of birth defects from the illness as well. These diseases once dominated and killed thousands to millions of people, but as we continue research, we will find these vaccines that greatly help and at times even eradicate diseases. Since 2010, there have been 10,000 to 50,000 cases of pertussis, or whooping cough, recorded every year in the United States. Every year, 10 to 20 babies die in the United States from whooping cough. Many of these babies were either too young to receive vaccines, may not have been able to because of allergies preventing them from using them, their immune systems may not be strong enough, or they could not use them because of their parents' beliefs on vaccines. When you receive vaccines, you are not only protecting yourself from the diseases, but other people as well who may not be able to use vaccines or have chosen not to. Also, although there is a vaccination for polio, there were 93 cases of polio in Pakistan in 2013 and 71 cases in Pakistan in 2014. The disease can be incubated inside a person for years while going unnoticed. Then from there, they can accidentally transfer it to an unvaccinated person, infecting them. The disease then mutates into the paralytic form, causing life-changing effects in people. When you receive a vaccination, it eliminates the possibility of accidentally transferring the disease between people, not only preventing the harm of you, but preventing harm on others as well. Every year, hundreds of thousands of people are killed by vaccine-preventable diseases. 453,000 children die annually from rotavirus all over the world. 476,000 children die annually from pneumococcus globally. 199,000 children die annually from HIV. 195,000 children die annually from pertussis, and 60,000 children die annually from tetanus globally. All of these diseases are vaccine preventable and are proven to work. So by getting these vaccines, you are potentially saving your own life. As you can see in the chart on the left, there were 549,000 cases of measles every year before a vaccine was produced. Now, after the vaccine has been produced and distributed, there is only 62 cases of measles every year. And on the right, you can see that on the left you have the morbidity rates or the morbidity numbers annually in the U.S. for all of these diseases. And then on the right, you can see the most recent reports of cases in the United States. So for Just the mumps, there were 162,344 deaths in the United States before a vaccine was created. And there was now a 99% decrease with only 982 cases per year in the U.S. And with polio, there were 16,316 deaths every year in the United States. But now there was a 100% decrease after a vaccine was created, and now there are 0 recent reports of cases in the United States. Here we have another chart showing how before vaccines were created for these diseases, there were hundreds of thousands of cases reported every year. Now, since vaccines have been created and have worked, there has been a dramatic decrease in the number of cases, and the percent decrease has dramatically raised. For example, with pertussis, before the vaccine was created, there were 147,271 annual cases found, but then after a vaccine and in 2009, there was only 13,214 cases found, with the 91% decrease. And then with tetanus, before the vaccine was created, there was 1,314 cases found every year. Now, there's only 18 found, with a 98.6% decrease. These are just some of the examples of how vaccines have helped decrease the number of cases of these diseases over the years. Now for the expert outreach. For my expert outreach, I reached out to 3 people that I personally know: Nick Rapp, Stacia Essler, and Joe McGovern. First, for Nick Rapp, I asked him what his experience with vaccinations or in the medical field was. And he said that he is a chiropractic physician, so he has learned about all aspects of healthcare and schooling, and deals with vaccines indirectly because people ask for his opinion all the time. He supports the use of vaccinations. He supports them because of the science behind them. As an evidence-based practitioner, he uses the evidence behind vaccines to support them because most do save lives and prevent illness more than the harm they can cause. He doesn't support all vaccines, but many vaccines have evidence behind them showing that they have saved millions of lives, and these are the ones he does support. He has children, and so I asked him if he feels safer when they receive a vaccination, and does he believe that it is essential for their health. And he said yes, it is essential for their health. Then I asked if he was required to get vaccinations growing up. I said, if so, do you believe they helped you in the future? He said that having divorced parents, his mom supported vaccines and his dad didn't. So it really depended on the time and situation. His parents' opinions of vaccines did not build his own opinion, though. He said that he looked at it in an evidence-based manner and then built his own opinion. I asked him then what are some drawbacks about vaccinations because he is supportive of them. He said that some vaccines are focused on population savings or economic savings rather than the general health of the population. He believes that when it comes to vaccines like the chickenpox, they found that you need a booster vaccination every few years to renew the immunity. But he also found that by doing this, it will save them billions of dollars in lost days of work if these vaccines are used. So for some of these vaccines, he's trying to get at how they focus on the economic savings rather than the general health of the population, which isn't the goal of vaccines. I asked him then how he thought that vaccines have improved over the years. He said they have improved because the public is aware there are problems with current vaccines, and they will continue to improve because of this. For example, as people are scared about vaccines containing mercury in them, they will push to make vaccines safer and better without those bad things inside of them. Next, I talked to Stacia Essler. She has given many vaccines because she worked at Minute Clinic for a long time and has worked in other offices as well. She supports the use of vaccines. She supports them because people die from not receiving vaccines, and illnesses like the chickenpox can cause deafness and negative neurological effects in babies under 1. Polio can cause paralysis, and by receiving these vaccines, it protects people from this damage. She also believes that it is essential for her children to receive vaccines because going through the daycare center, illnesses like rotavirus can spread very easily between children and can make them very sick. If these children just pass on the virus, it can create a strain on the children, the parents, and on healthcare systems. I asked her if she had to receive vaccines as a child, and she said yes, because to go to school she was required to get them. Because at the time not many people were against them, because of the negative impacts of the diseases if they did not receive them. She believes that even though children may not always receive vaccines, they have the benefit of herd immunity because they are surrounded by other children who are vaccinated. And so, even if they are not vaccinated, they have a better chance of not being infected because there is a less chance of the people around them being infected. So, she believes that receiving these vaccines has helped her and others around her. A drawback of vaccines is before it was removed, using vaccines always brought with it the risk of the vaccine containing mercury, which some people were convinced could lead to the development of autism, which has been proven inaccurate. She also says that pain is a minor drawback because it can lead to soreness in the limbs for a few days at a time. And also with younger children, fear is a drawback because many children are traumatized by the idea of needles and sharp things poking into them. But she believes that they have improved over the years because we learn as we go. And they have learned things like we need a booster for chickenpox vaccines, and this has led to the prevention of many symptoms and illnesses that have been major problems before. These pros do not always get publicized, although, and people can only connect the negative effects of vaccines and not bring to light the positive factors, she says. My last expert that I reached out to was Joe McGovern. And although Joe may not have as much experience with vaccines as Nick and Stacia do, she has a different experience with them. She has a more negative outlook and experience with them than others might have. And I thought it was a good idea to get both sides of the story on vaccines, so I reached out to her. Joe has had 3 children receive vaccinations as young children, but not the newer ones until there has been more research conducted to support them. Her youngest child fell very ill, possibly from the influenza vaccine, and now is very sensitive to vaccines and cannot receive very many. She supports vaccines for younger patients that she and her children have grown up with, like the chickenpox vaccination and the HIV vaccination. But she opposes vaccines that are recommended after the age of babies and younger children, especially the flu shot, because of the incident that occurred. She says that if there is not enough research behind vaccinations to show they have a positive effect or impact, then she doesn't find a need to receive them or have her children receive them. So she's not going to support these vaccines unless there is enough research behind them to show how they help. When I asked her if she believes that she feels safer when her children receive vaccinations and if it is essential for their health, she replied with, "Now that her children have grown up, she doesn't believe that most vaccines are necessary. But as babies and children, she supports the use of those vaccines, except the tetanus shot, because they have been proven to help. Now that her children have grown up, she doesn't agree with them getting vaccines unless it's their decision and they really want to. But she doesn't find the need for them to receive them, and she doesn't find a need for herself to receive them either." She said that she received vaccinations as a child and believed that they helped her health because if they hadn't helped her, she wouldn't have supplied her children with them. She didn't want to take any chances when her children were younger because these vaccinations had worked, and she didn't want them to risk being sick if they did not get the vaccines. When I asked her about what are some positive things about vaccinations, she said that from research, HPV has been shown to prevent types of cancer, but otherwise there are no positive impacts in her opinion of the newer vaccinations without more research being conducted. I asked her how she believed that vaccinations have improved over the years, and she said that since she works with children who have autism, and with all of the backlash of vaccinations possibly causing autism, which, like I said before, has been proven to be inaccurate, she says that she doesn't know if it could be a possibility of a cause of autism, but she thinks that if mercury in these vaccines was a cause, then more children would show signs of having autism after receiving vaccines. She says as time progresses, new things have been added to vaccines, so she believes more research needs to be conducted to know if these vaccines are healthy and are suitable for people. Lastly, here's my cited sources. If you have any questions, feel free to comment in the comment section below or look at any of these websites to see if you can find any extra information on vaccines. I hope this video has given you a good viewpoint of both sides of the opinions of vaccines, but ultimately has helped you realize the pros of using vaccines and how they can benefit your health.